Hello folks, I'm Dr. Tony Nesterenko, and today what I want to talk to you about is peripheral neuropathy. And you may have the neuropathy in your hands, feet, or both, and we treat both of those. And how we treat these folks is neurologically and metabolically. Now I know most of you have gone to 10, 20 different doctors for this problem, and pretty much everything has failed, and I want you to know that there is a treatment for this and there is a way to get better. So what do? We start off with our patients, we check them neurologically first thing we do, and what we want to see is we want to see how that brain is working. The brain is not firing like it should. The electrical impulse from the frontal lobes to the lower brainstem to the upper brainstem is altered. The frontal lobes cannot fire down to the feet like they should, so the feet are going to start suffering neurologically. There has to be electrical impulse strong enough to keep those feet healthy. And what you'll see in a lot of these people, when the brain is not firing to the feet like it should, you'll notice that the toenail on the big toe looks like it's got fungus under it. It looks all gnarly. It's like it's been hit with a hammer. And a lot of people think that's fungus. And what that is decreased firing of the brain. It causes that toenail, in most cases, causes that toenail to become looking like it's fungus, got a lot of fungus in it, but that's not what it is. And I see this in many of our peripheral neuropathy patients. So what we do with these patients, we use brain-based therapy. Dr. Michael Johnson, who wrote this book, What Do You Do When the Medications Don't Work? A Non-Drug Treatment for Dizziness, Fibromyalgia, Migraine, Headaches, and Other Chronic Conditions. He trained me, and Dr. Frederick Carrick, he's a world-renowned neurologist. He's the founder of brain-based therapy. He's an MD neurologist, but he's the only neurological chiropractic fellow in the country. And that's what he uses in his hospital, and people come from all over the world to get his treatment. And it's very difficult to get into Dr. Carrick. He takes like 1 in 10,000 people in his hospital. So he has doctors out in different states like us that do this care, and I'm one of only 3 doctors in the state of Arkansas that does brain-based therapy, and the only one in Little Rock. So what we do is we check you neurologically, and we have some neurological tests that we check you with, and if we've got a neurological problem there, what we do, we use exercise with oxygen therapy with our patients. And oxygen is very important. How well you're utilizing your oxygen is the most important thing. We have a little machine that checks your saturation and your perfusion of the oxygen in your blood. And perfusion is the most important. Perfusion means how well your oxygen is getting to your extremities. If your extremities are suffering from decreased oxygen levels, it's like a plant that's suffering from not enough water. And so you know what happens with that plant. And the same thing goes with your feet or your hands. They die. The nerves start to die. They're not getting enough oxygen. So this is called oxidative phosphorylation. And as we age, starting at age 25, believe it or not, I was surprised to hear that myself. Starting at age 25, we lose 1% of oxygen a year. And so if you're 50, you've lost 25% of your oxygen levels. So what we have to do with our patients, we put them on exercise with oxygen therapy to get their oxygen levels up. And that's one of the treatments we use. One of the others we use with this, we use a machine that it stimulates the nerves. We put that on your feet, and it stimulates the nerves from the bottom up. Now we're going to be working from the top down, and we stimulate the nerves from the bottom up with this machine. And it's very, very successful. The other thing we use is vibration therapy. We also use glutathione with our patients. And glutathione, folks, is the most potent antioxidant there is. And there's 5,700 research articles on glutathione. And as we age, starting, past age 25, we start losing glutathione levels start going down. And this glutathione is stored in your liver. If your glutathione levels are low, we want to get those glutathione levels up, because when the glutathione levels are down, you can have neurodegeneration of the nerves. So we want to get those nerves healthier, and that's why you're having tingling and burning in your feet and numbness. You can't feel, and also it affects your balance. And we want to use that glutathione level. And there's 2 ways to get glutathione into your system. pills don't work because your body can't utilize them. Either use a intravenously, or we do it via nebulizer. And we don't do needles in our office, so we do it via nebulizer. So you breathe it. And we have a formula that Dr. Johnson, Dr. Carrot taught us, and that's what we use in our office. So glutathione is another treatment we use, very important. So let's go back. What do? We use brain-based therapy. We get the brain firing. If we got a brain problem, a decreased firing of the brain, we want to fire that brain. By adjusting unilaterally, we use exercise with oxygen therapy, we use auditory stim, auricular therapy, warm water calorics in the ear, things that you never see in other doctors' offices. That's what we do, and that's why we're successful with this. The other things we use are the machine that we put on your feet that stimulates the nerves from the bottom up, and it really gets those nerves firing back to the brain. So we're going to work from the brain down to the feet and the feet back to the brain. Get the communication levels up. We want to get your perfusion and saturation levels up, your oxygen levels in your blood. We want to get those back to optimal level. And we want to get some glutathione in your bloodstream. Now the other thing we do, we check you metabolically. Now a lot of people say, oh, I've had all kinds of lab tests, doctor, and my lab tests are fine. Well, that's from your medical doctor's perspective. There's lab ranges and there's functional ranges. We look at your lab test and we have our numbers a lot narrower. Let's say, for instance, your thyroid. If your thyroid out of whack can affect your feet and your hands and cause peripheral neuropathy. And your doctor's levels are from 0.35 to 5.0 on your TSH levels. We look at it from a lot narrower range. We look at it from 1.8 to 3.0. That's where we want your levels to be. And I'm just going to give you a few examples. Also your glucose levels. We like to see you around 89 to 85 on your glucose levels. Your medical doctor, you got 105 or 110, and they say you're fine. Well, I'm going to tell you folks, that's not good. That's too high. We can find out what's going on there, and we can help you with that. Get those levels down. If your levels are not coming down to that, you're not going to respond to the treatment that we do in our office. Also, you want to look at your Th1 and Th2 levels. Are you autoimmune? If your Th1 or Th2 level is out of balance, they should be in balance, then you may have a parasite. You could have a fungi. You can have a mold in your system that's causing this level to be out of whack, and that causes high inflammation levels. Some things that you have to look at on these patients and see if these things are in balance. If they're not in balance, we can help you with that also. We want to look at your adrenal glands. If you got high stress in your life, folks, you're going to have large doses of cortisol being released in your bloodstream. That's another thing that will ruin your chances of getting better with peripheral neuropathy. So we have a test for that. We check your cortisol levels. And if we get those back in balance, we want to decrease our stress. We want to make sure our adrenal glands are working correctly. We want some things that hurt your adrenal glands is coffee, smoking, those kind of things will make your adrenal glands not work as well as they should, and we can help get those adrenal glands back in shape and get them working again. There's just a number of things in your blood work that we look at. That's to give you a few examples. So don't fall in this little thing that the doctors tell you that you've done everything you can do, and there is other things you can do, folks. We're doing something totally different than your medical doctors do. We're not going to give you drugs. We're not going to give you medication. We're going to get to the cause of the problem, and we're going to treat you neurologically, metabolically, and get you back on track. And as you age, you need that balance. You need that feeling in your feet. You don't want to be falling. It causes people to fall real easy, and they lose that feeling in the feet, the message from the feet to the brains, not getting back up there like it should. So if you're interested in having a look at this, come in and let us test you neurologically, metabolically. We'll do that. We'll check your saturation of your oxygen, your perfusion, and we'll see if we accept you for care in our office and try to get your health back on track. Give us a call, and we look forward to hearing from you. Thanks.